All right, so let's do a little intro to aseptic technique. And this is something that we're going to see come into play as we start looking at hand hygiene and non-sterile glove usage. So let's start with what is asepsis. So asepsis is basically an act to keep us free from disease or free from infection. So that's the goal, both us and our patients free from disease. So how do we do it? Well, we're going to employ something set out by the World Health Organization and CDC. And these are basic guidelines called the standard precautions. And standard precautions essentially basically tell us to treat every patient as if they are actually infected with a infectious disease. So as long as we treat everybody like they could be carrying a contagion, then we can be very mindful of our practices and avoid portals of infection. And these guidelines extend into like how we interact with our patients, the types of things that we wear when we wash our hands, how we interact with sharp objects, how we interact with linens and laundries, and those sorts of things. So we're going to just look at like PPE and hand hygiene, which is really looking at the basic meat of standard precautions. So standard precautions always relies on the 5 essential moments for hand hygiene. And we've looked at these before. They are to wash our hands thoroughly with warm water and soap for at least 20 to 30 seconds of lathering on all contact surfaces before we contact a patient, after we contact a patient, anytime we've come into contact with any kind of bodily fluid or fluid of unknown origin other than our own. And then also after touching a patient's surroundings, so the chair, the exam room, their belongings. And then also before any kind of aseptic procedure. So we're going to focus on those last 2 things, like bodily fluids and aseptic procedures. So we're about to start using non-sterile gloves. And the main thing is if we're going to be in contact with body fluids, if we expect it or it does happen, we have body fluids, we need a barrier, B&B. Okay, so if we anticipate being in contact with any of the following, so mucous membranes, the mouth, the eyes, the nasal cavities, the genital passageways, any portal into the body requires use of non-sterile gloves to examine or to treat that area. In addition, any kind of contact with any bodily fluid that escapes the body, so that includes vomitus or emesis, saliva, mucus, sputum from the lungs, any kind of discharge from the eyes, urine, semen, feces even are counted as bodily fluids, even if they are solids, and of course blood. And so any procedure as well that might increase a patient's risk of infection is also going to require glove use. Now, I'm not talking about any kind of surgical procedures because those require a higher level of vigilance, but I'm talking about any aseptic procedure. And these are essentially, I think of them as ones that are invasive, which means I'm probably going to break the skin or I'm going to need to insert an instrument into the body. And so these invasive procedures might include things like setting IVs, giving injections of any kind, drawing up injectables. So if I'm setting up something that is going to be used or put into the body, then I want to be extra clean and not drag any of my germs onto the surfaces that will enter the patient. They would include things like catheterization. So if I'm going to place a Foley, if I'm going to like dress or drain a wound, and even if I'm going to do some sensitive lab work, like taking a culture or preparing a culture from a patient, I would be using aseptic technique. So again, just if you're going to break the skin, if you're going to contact a mucous membrane in order to give this treatment, then it requires aseptic technique, which means we need to do our hand hygiene And then we need to do our hand sanitizer, and then we need to let that dry and then put on non-sterile gloves. And those non-sterile gloves, just in the last slide, those come out of a box, like a tissue box. And so they're not sterile, but they are clean, and they are clean barriers that have not been around other patients. These are not the same as surgical gloves. Surgical gloves and equipment, any kind of gowns, those sorts of things, those types of gloves are sterilized. And so that means that they are prepared, they are individually wrapped, and then they're placed in an autoclave that superheats it and kills all germs and pathogens that could possibly be on it. Whereas a non-sterile glove essentially is just a barrier between your biological tissue and somebody else's. And so it's not necessarily super clean and devoid of all infectious agents. It's just cleaner than your clean hands. Yeah. So hopefully that clarifies when we're going to be using gloves, when we're going to be using non-sterile gloves. We are not going to be using sterile procedures or surgical procedures, at least not until we get into the second year. And these are just kind of an intro to our basic standard precautions.